So the journey can begin wherever it's needed to begin. Typically, patients come to me already knowing their diagnosis, but not always. Sometimes patients might be referred to the breast center because they have an abnormal mammogram that their primary did, and now they've been sent for a diagnostic mammogram and a possible biopsy. Well, what's this biopsy? What's that biopsy? So they may call and ask questions and want guidance before they've ever entered the breast center proper. And so I talk them through that experience. It's education. It's often support. It's helping them get into the system.
Yeah.
And then once they have their diagnosis, there can be many different trajectories that they might take. They might need to go to meet the medical oncologist first because their cancer has features that they may need chemo before they do surgery. Or they might be that next visit, once we know they've got a positive diagnosis, I get them set up for surgery and planned surgery. May need other testing before they go. They might need an MRI. So whatever it might be, I kind of shuffle them along, explain the process, come alongside of them when they get overwhelmed and confused. And they are often, because it's a lot of stops.
So again, like Robin said, if they've come into her breast center, then we may see them in radiation oncology. So then that's when they also get introduced to me, and more so on their survivorship piece, because we know it just doesn't stop once you finish treatment. The resources that you need look different for everyone. And again, they may just not stop. You may be fine or feel like you're doing okay, and then something happens months or years down the road, and you still have access to us. We still can connect you to resources, referrals, being that patient advocate, coordination of care, those kinds of things.
And one of the things that patients used to always say to me is, they're like watched pots for such a period of time. They're coming in, they're seeing a doctor, they're doing everyday radiation therapy, they're getting checkups, they're getting their blood, and then their treatment stops and they've completed therapy, and nobody's going to see me for 3 months, or I don't need to come back for 6 months, and they've used the word. It's like I've just kind of been dropped, and so Rochella's job really is to help them make that transition from being under active treatment. This is day in, day out, somebody doing this appointment after appointment, to, oh, we're not going to see you for 3 months or whatever. Yeah. So she really helps come alongside of them as they make that. At the breast center, I kind of help them make the journey into the process. She helps them move beyond the diagnosis into really accepting this new experience as being a cancer survivor. Mm-hmm. Well, each patient comes to us and it's a crisis, Mm-hmm. As healthcare providers, we deal with this diagnosis daily. It's, but it's a foreign world to the patient that comes to us. The language, the abbreviations, the tests that they have to do. These are all foreign things that a patient sometimes says, I've never been sick in my life. Mm-hmm. And now they go from being healthy and well to, I have this diagnosis of cancer. It's a team, that's for sure. And our team includes, of course, the physicians who are involved, but also the social workers play a big role. We have outreach workers. We have nutritionists. We have radiation therapists who deliver treatment. So it really is a team effort, and it takes all of us. There's not one of us who says, my job's not necessary, or they could find somebody else. I mean, it takes a team, and not only within the cancer program, but outside of the cancer program. Mm-hmm. We have many resources, community resources that help. Gasoline, for example, we all know the price of that. Think of coming from Rochalla to Easton Monday through Friday for a treatment that you have to pay for gas for, and you're going to be coming for 5.5 or 6 weeks, maybe. That adds up quickly. So we do try to tap into some of the resources that are available to help patients when there are financial burdens. And there are private organizations that, we've all heard of them, help to defray some of the cost of cancer. There's a word for it. It's called cancer toxicity, financial toxicity associated with cancer treatment, and it's real.
We would use the phrase new normal or new me. Yes, it's going to look different. And what we can connect you to help you take that path, that new journey, and help you live your best life going forward is what we do, is what we hope to connect you with.
I had a patient who told me one time, and I worked in the doctor's office where we had elephants in the room. And she said to me, she said, Robin, having a cancer diagnosis is like having an elephant in your living room. She said, initially, you can't go anywhere without bumping into it. It's always there. You can't go through that room without seeing it. It's always there. She said, but with time, that elephant gets smaller, and it gets to be about the size of an end table that you can kind of tuck in the corner. She said, you can traverse the room, and you can come and go, and you can live your life. And there are days that you might not see it, but it never leaves. It's always there. And I thought that was so profound to me. It just really explained, it gets pushed eventually with time, and everybody's time is different. But it's an analogy that I have used hundreds of times in my career. Just explain it. It will get smaller. It will get pushed to the back. But there will be times maybe right before your next mammogram, or times while you're waiting for the result of that test to come in, that it's going to be pretty big again, But I thought that was very helpful, and it kind of explains a little bit about how patients feel.